The stone slips across your palm. At first, it is only a cut. Blood runs between your fingers, dust clings to the skin. Tiny pieces of stone and dirt may already be inside the wound. By evening, the bleeding has slowed. By the next day, the skin is hot. Then the swelling begins. There are no antibiotics, no sterile bandages, no hospital. So what happened when an ancient human's wound became infected? The first correction is important. Not every cut became infected. Your skin is a barrier. Your blood clots. Your immune system attacks microbes long before you know they are there. Ancient humans survived thousands of scratches, bites, burns, and punctures because the body can repair itself. But some wounds were different. A deep cut could trap dirt. A broken bone could pierce the skin. An animal bite could push bacteria far beneath the surface. A stone point could leave fragments behind. And once microbes multiplied inside, warm damaged tissue, a small injury could become a threat to the entire body. We rarely find prehistoric bandages. Leaves decay. Animal hide rots. Plant fibers disappear. Even a carefully clean wound leaves almost no archaeological trace if the person recovers. Bones preserve only the most serious cases, especially when injury or infection reaches the skeleton. That means the evidence is biased. We see the injuries severe enough to mark bone. We usually do not see the ordinary cuts that healed successfully. Still, one discovery shows how advanced prehistoric wound care could become. In Liang Tebo cave on the island of Borneo, archaeologists found a young person who lived about 31,000 years ago. The lower part of the left leg had been deliberately amputated, probably during childhood. The cut surfaces of the tibia and fibula had remodeled. The person survived for another 6 to 9 years. There was no skeletal evidence of an infection severe enough to destroy the limb or cause death. Think about what that required. The operation had to avoid fatal blood loss. The wound had to remain manageable in a tropical rainforest where heat and moisture can favor rapid infection. The patient then needed food, protection, movement, and long-term care in steep, rugged terrain. The researchers inferred that the wound was probably cleaned, dressed, and monitored. They also suggested that locally available plants may have been used for pain relief or infection control. But the exact treatment did not survive. The bone proves survival, it does not preserve the recipe. Most infected wounds would not require an amputation. Imagine your cut again. Someone in the group examines it. Visible dirt is removed. Bleeding is controlled. The wound may be rinsed. It may be covered to keep out insects and new debris, or left open when trapping. Contamination would be more dangerous. We cannot know one universal prehistoric method. Different groups lived beside different plants, water sources, climates, and animals. Their knowledge would have been local. What mattered was observation. A wound that became less painful and less swollen was improving. A wound that became hotter, redder, more painful, or filled with foul-smelling fluid was changing in the wrong direction. Fever, weakness, confusion, and rapid breathing meant the danger was no longer limited to the skin. Ancient people did not know the word bacteria. They did not need the word to recognize a pattern. This cut heals, that bite kills, this plant calms pain. That covering makes the wound worse, this person needs to stop walking. That swelling must drain. Knowledge begins before explanation. It begins with repeated consequences. Neanderthal skeletons provide another part of the story. Many individuals survived severe injuries and illnesses long enough for bone to heal. A major review of Neanderthal healthcare argued that care for injured group members was widespread and effective in reducing mortality risk. That does not mean Neanderthals had doctors in the modern sense. It means survival after serious trauma was common enough that cooperation cannot be ignored. Rest itself was treatment. An injured hunter who kept walking could tear the wound open. A feverish person who searched for food alone could collapse. Someone else had to carry water. Someone else had to share meat. Someone had to maintain the fire and watch for danger. The infected person's immune system did the biological work. The group bought it time. Plants may also have played a role, but the evidence must be handled carefully. At El Sidrón cave in Spain, researchers analyzed hardened dental plaque from Neanderthal teeth. One individual had a dental abscess and evidence of a chronic intestinal pathogen. The calculus contained evidence associated with poplar and penicillium. poplar contains salicylate-related compounds, and some penicillium species produce antimicrobial substances. The researchers interpreted this combination as evidence consistent with self-medication. But it does not prove that Neanderthals manufacture antibiotics. It does not prove that penicillium was placed on a wound. And it does not tell us the dose, preparation, or intention. The safest conclusion is smaller and still remarkable. At least some Neanderthals consumed substances that may have had medicinal effects while they were ill. Prehistoric medicine was probably built from this kind of practical experimentation. Chew a bark, crush a leaf, wash with one water source instead of another. Use a clean piece of hide, keep flies away. Stop a person from reopening the injury. Some choices helped, others did nothing. Some may have made the infection worse. There was no guarantee that tradition was correct. But successful practices could be remembered and taught. The body also had several possible outcomes. A mild infection might remain local and eventually heal. An abscess might form, trapping pus inside a pocket. If it drained, pressure could fall and recovery might begin. If infection spread into bone, chronic osteomyelitis could develop. Bone may react by producing new tissue around areas of destruction, leaving signs that archaeologists can recognize thousands of years later. If microbes entered the bloodstream and the immune response became uncontrolled, the result could resemble what we now call sepsis. At that point, survival without modern treatment would be far less likely. The most frightening moment was not always the original injury, it was the quiet change afterward. The wound looked small, then the person stopped eating. They began shivering beside the fire. Their breathing became fast, they could no longer stand. The group could provide warmth, water, food, cleaning, and protection. But sometimes the body lost. That is why infection shaped behavior even when no one understood microbes. Avoiding a dirty cut was better than treating one. Sharp tools were valuable, but dangerous. Animal bites were feared for good reason. A person cleaning a carcass had to control the blade. A traveler with a foot wound could slow an entire group. Care was not only compassion, it was survival strategy. A skilled adult represented years of learning. Saving that person preserved hunting knowledge, roots, tool-making skills, and relationships. Helping one injured member could cost food and labor today. Losing that member could cost much more tomorrow. This is the counterintuitive answer. The most powerful prehistoric treatment may not have been a mysterious healing plant. It may have been another person, someone who cleaned the wound, someone who brought water, someone who shared food. Someone who noticed that the fever was rising. Someone who allowed the injured person to rest instead of being left behind. Medicine began not only with substances. It began with attention. You look down at your palm again. The swelling is still there. The group does not know what a bacterium is. But an older member has seen this before. They remove the dirt you missed. They keep you near the fire. They make you stop using the hand. For several days, someone else does your work. The wound may still win. Nothing in prehistory was safe. But if you recover, the lesson remains. The next time a stone slips, the group packs faster. And long before anyone could see microbes, human beings were already learning how to fight them. If you enjoyed this journey into the distant past, subscribe for more stories about ancient humans and human evolution.